Hi, my name is Michelle, and I am a student pharmacist at WSU College of Pharmacy and Pharmaceutical Sciences. The intention of this video is to educate providers on the need of increased testing, reduce stigma, understanding the point-of-care screening recommendations, and walking through an overview of care. We want to screen patients before they present with clinical signs and symptoms of liver dysfunction. Left untreated, HCV can develop into chronic HCV and lead to cirrhosis, liver cancer, and eventually liver transplants. The benefits of screening and getting tested earlier are seen in quality of life, cure rates, and decreased expanded healthcare costs. Current FDA-approved screening has 97% sensitivity and 100% specificity, so this gives us a really good idea on who to screen for the HCV RNA in the serum. The current CDC recommendations are adults ages 18 and older get tested at least once in their life. However, some patients who are at increased risk should have increased screening. The current CDC recommends that all adults ages 18 and older get tested at least once in their lifetime. Some special populations who may benefit from increased testing are pregnant women. There is an increased prevalence of HCV in women aged 15 to 44 and in infants born to HCV-infected mothers. So this means pregnant women should be screened during each pregnancy. Other patients are IV drug users, patients who have accidental needle sticks, or get unsanitary tattoos or piercings. So now I'll be walking through the screening and what that looks like. Patients are going to present for their annual wellness visit, or if you identify patients who have the risk factors that we just mentioned, you're going to offer the HCV antibody test. As mentioned earlier, the CDC does recommend anyone over 18 gets tested at least once in their lifetime, so kind of just making sure your patients know that it's normalized to get tested. So with the HCV antibody test, you can be positive or negative. It's important to note that positive antibodies does not mean the patient has active HCV. This means they were exposed at one point of time in their life, and it was either treated or they spontaneously cleared the infection, which is definitely possible. It also could mean it was a false positive test. A non-reactive HCV antibody test means no further action is required. After the reactive antibody test, the next step is to order the HCV RNA test. If undetected, there is no infection and nothing else is needed. If detected, this means they have current HCV infection and should be linked to care. Continuing on, if the patient has concurrent HIV-HCV infection, they should be referred to infectious diseases. If they are not co-infected, their primary care physician can manage them if they choose to. If the patient has severe liver dysfunction, such as cancer, cirrhosis, or decompensation, if they have end-stage renal disease or are pregnant, they can be referred to the GI clinic. If the patient is a current substance user, the primary care doctor may choose to manage them if they're comfortable, or they can also be referred to the GI clinic. As for the overview of care, it's about 4 appointments total. The first one is the screening, where you get the initial labs for a baseline viral load. After lab interpretation and finding out their patient-specific genotype, a medication is prescribed. After 4 weeks of being on this medication, they should really check in with labs to assess their viral load. At this point, as long as the patient has been adherent to their medication regimen, the HCV should be undetectable at this time. 12 weeks after treatment, you should also get another set of labs. If the Hep C virus is not detected in the blood after 12 weeks or more, this is called a sustained virologic response, or SVR, and this is indicative of a cure. For pan-genotypic, or genotypes 1 through 6, available options are Epclusa, 1 tablet daily for 12 weeks, or Mavyret, 3 tablets daily for 8 weeks. If the patient has an HCV-HIV co-infection, you can do Epclusa or Mavyret, as I mentioned, or you can do Harvoni, which is 1 tablet daily for 12 weeks. In patients with an eGFR of less than 30, we can do Mavyret, as I mentioned, or Zapadier, 1 tablet daily for 12 weeks. And lastly, salvage therapy, for patients previously treated without a cure, whether that be they were not adherent to their medications or they just didn't have the correct medication for their genotype. We can do Mavyret as above, or Vosevi, which is a 3-medication combination, and it's 1 tablet daily for 12 weeks. Thank you so much for listening to this video. If you have any questions, please reach out to Kootenai Clinical Pharmacist Mary Thidbo or Kootenai Specialty Pharmacist Sean Cooper. Thanks.